Hey, check two. Hey, check, check. Mic check.
Hello. 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 We are about to start the event. I request everyone to be kindly seated, please.
Hello.
Good morning, everyone. We are beginning our program shortly. I request everyone to kindly be seated. Now, on to the event. On behalf of International Food Policy Research Institute, South Asian Association for Regional Cooperation, Bay of Bengal Initiative for Multi-Sectoral Technical and Economic Cooperation, and Institute for Integrated Development Studies, I, Sneha Vaidya, Research Assistant at IIDS, welcome you to the second day of Global Food Policy Report 2024. Our first session today focuses on the way forward in food policy and systems. I invite our session chair, Dr. Tora Narayan Gyawali, Member Secretary, National Planning Commission, Government of Nepal. Dr. Toya Narayan Gyawali is the Secretary of the National Planning Commission, Government of Nepal, a position he has held since June 2023. With a PhD in International Political Economy and two master's degrees in Political Science and Public Administration, Dr. Gyawali has a distinguished career in public service. He has held key roles including Secretary of Ministry of Industry, Commerce and Supplies, and Secretary at the Office of the President. The floor is yours for an hour and 25 minutes, sir. Thank you.
Okay, thank you. Very good morning, distinguished delegates, experts, uh, panel members, and all the distinguished participants. Very good morning and namaskar. It is my privilege to participate in this important conference. I would like to extend my gratitude to the IIDS, IFPRI, BIMSTEC, and SARC for inviting me. I would like highlight two major information here. When I got email from IFPRI, I just scanned the report of the 2024. There I saw some of the highlights, the correlation and relation between our food habit and then non-communicable diseases. So that was new knowledge for me. So I motivated to join this program. In my individual case, I had a 5-6 medicine. I used to use 5-6 medicine back to 5-6 years. But I changed the food habit and there is no medicine in my life today. So thank you for this type of research. And we are really grateful for the contributor to this report. Before joining this meeting, I listened about 2 hours debate somewhere in the global while launching this report. That was very, very encouraging. And some of the experts are here, I'm seeing, so I would like to congratulate and thank them. I'll be very brief because there are so many important panels to listen to us. I would like to highlight 2 or 3 things. In this session, we will discuss basically on how to improve the consumer dietary choices and how to improve the process of fortification and biofortification, how to bridge policy and action gaps that has been highlighted by the report and many other research, how to enhance the implementation of the SDG that we are implementing, and some of the best practices from our neighboring countries, Maldives, India, and many others. So I will try to conclude the session within the time. At first, I would like to request Dr. Atul Upadhyaya, sir, on the dais, please, sir. Dr. Atul Upadhyaya is a nutrition specialist for food system and fortification at the UNICEF Regional Office for South Asia. He has a very robust background in nutrition and food technology. Atul has been expertise on shaping national, regional, and global policy issues. We will listen from Atul sir, basically for the I think recap of the last day, yesterday. Likewise, I would like to invite sorry, Avinash Kishore will recap. Likewise, I would like to invite Avinash Kishore sir on the dais. Avinash sir. Avinash. He is a senior research fellow in the Development Strategies and Governance Unit in IFPRI, a South Asia office in New Delhi. His research focuses on understanding how public policies and market affect the adoption and non-adoption of sustainable technologies and practices in agriculture in South Asia. He leads research projects on understanding food system in Bangladesh, India, and Nepal, and the policy research components of the Cereal Systems Initiative in South Asia, CISA, a program implemented jointly by CIMYT and IFPRI and IRRI. Avinash also studies agriculture nutrition linkages in India and the rising consumption of highly processed foods and food away from home. We'll listen from Avinash. Likewise, I would like to invite next, I would like to invite, online, but I would like to invite on this conference, Jamie Morrison. Jamie Morrison, I think participation online. I would like to highlight some of the background of the Jamie Morrison. Dr. Jamie Morrison is a senior advisor at GAIN, supporting national and global initiative to strengthen food system policy. Director of Food Systems and Food Safety at the UN, served before. And he brings more than 30 years of experiences at the research, capacity development, and technological assistance. So I would like to invite Dr. Jamie Morrison. Likewise, I would like to invite Jay Das. Please, Jay Das on the dais. Dr. Jay Das is the Assistant Director at the Institute of Global Health and Development and Assistant Professor at Aga Khan University, Karachi. He is the Country Director of the Kuchan collaboration. He has been actively involved in research, including community and clinical-based trials, population-based surveys, and he is a very strong background on qualitative and mixed method research. I would like to welcome you, sir. Likewise, I would like to invite Jason Shu. Jason Shu, please. He is he's serving USA Nepal since 2021. He's the economic growth expert. He has his focus is in balanced economic prosperity with the environmental sustainability. He prioritizes partnership with the governments and the private sector to achieve development impact for women, youth, and some of the targeted people. In Nepal, he leads a portfolio that strengthens market system for agriculture, improves the country's trade and competitiveness, and advance locally led development in marginalized community. I welcome you, sir, in that dais. We have now Satish Mosa online. I would like to invite in this conference. Mr. Satish Mosa has been a dedicated member of the Maldives Food and Drug Authority since December 2009, currently serving as the Deputy Director General of Food Control, and he leads the Food Control Division and other issues. Finally, we have Ashok Dalwai. Dr. Ashok Dalwai, please, I would like to invite, sure. Dr. Ashok Dalwai is the chairman of the Commodity Derivatives Advisory Committee, Securities and Exchange Board of India, retired Indian Administrative Services, IAS, and he served Odisha and Karnataka. He has a strong expertise, basically on agriculture, farmers' welfare. I would like to invite you, sir. So at the outset, I would like to invite to recap the whole day, that is yesterday. And for that, I would like to invite Dr. Avinash Kishore, and I would also request to recap for the 10 minutes, I think, maximum 10 minutes, please, sir.
Good morning. Namaste. Can you put up the slides? I have a difficult job of capturing the whole day into 10 minutes. What I report here will definitely reflect my own biases. So apologies in advance to all the speakers and panelists if their points get left out. I would try to report even the differing points of view on how to move towards a healthier and nutritious diet. Can we put up the slide? Move to the next one, please. So the first in the inaugural session basically emphasized this framework or the 4 entry points that a global food policy report that we are launching here is that desirability is a challenge, meaning what people prefer and what the different things that shape our preferences and ultimately the consumption of healthy and nutritious food. That's one place where we are facing challenges, but also offers an entry point to move towards sustainable diet. The other is affordability. There was a presentation by Derek Heddy also later, which shows that a lot of people, about 3/4 of people in this region, South Asia region, cannot afford what is recommended by nutrition scientists and others. And that's a challenge that we have to grapple with. The third one is accessibility, which is about the value chains, the efficiency, and the fact that healthy foods are not always available. Price gaps are too much between farmers and there. So that's something that needs to be addressed and requires working on several fronts. And the last one is availability, which connects to what kind of food we produce and trade in to make sure that healthier foods are available at affordable prices throughout the year to all concerned, including in remote areas. So these are the 4 challenges, and related to it are entry points too. The second session focused on how do we support people's choices on healthy food. We had 2 presentations here, one on food environments by my colleague Sam Scott, where basically the takeaway, and you can go to his slides to know more about it, is that understanding different things that affect constraints to healthy diets can identify entry points. And the second thing that he underlined in his presentation is that cheap and unhealthy foods are everywhere. They're sometimes more convenient, and that is going to remain a challenge for movement towards healthy foods or healthy diets. The second presentation was more focused on affordability. This was done by Derek Hedy, and he basically, the takeaway, if you want, is that there is value to regular tracking of prices or a cost of healthy diets. It's something that it can be easily done with the kind of data systems we have in this region, and it's also worth doing. He also underlined that it's not the same. Tracking food price inflation is not a substitute because food price inflation measures something different. This is something that we should do and can be done. The panel, there are 3 panel members, and one issue that came out very strongly in other sessions too is that moving towards food systems transformation is not purely a technical or economic issue. It's also inherently political. So the kind of structures, institutions, transparency, and accountability, you need those to move towards it, to have an inclusive transformation. One way to do it that came out in a couple of sessions is that you collect high resolution, high frequency disaggregated data, and you share the good and the bad that the data reveals so that we can devise action. It's also important that the transformation message is inclusive, and it protects the interests of weak and the poor, that they are not left out to pick up the pieces. Another point that was made by one of the panelists who's here on this panel too is that private sector is a key interest group, right? It can be a force of good. They have interest in this transformation process. They are contributing to it, and they need both regulation and enforcement of those regulations, but they also need to be in rooms like this and a part of this discussion so that we listen. The last point, it's in Nepali, was actually that there's value in transforming these technical messages in concise versions in national and regional languages to the policymakers and other stakeholders, and that's something we should make a real effort to do. The third session was on role of women in food systems in South Asia. The first presentation here was by Neha Kumar, where she introduced a new tool that one of the CGIAR regional project in this region, TAFSA, tried and shared some of the findings. The tool is easy to use, and it has findings that we all know, but there's value in putting numbers to them, that women have a triple or double burden that leads to time poverty, lack of leisure, etc. It's known but not carefully studied. And these divisions, this kind of time deprivation exists, and they start early in life. So even this TAFSA project collected data from adolescents to, and there were differences even between adolescent boys and girls and what kind of roles they perform inside and outside house. In Nepal and also in other parts of South Asia, there's large scale male migration. Wherever that happens, the burden on women, but also on adolescents increases. And that's something that we have to keep in mind. The second is, like, I'm using a catch-all term. It was like the key message was that gender matters and matters on multiple fronts. One thing that was highlighted by the presenter is that Nepal's constitution is very liberal and very inclusive. But if you track the data, the guarantees, the promises that constitutions makes have not been achieved yet. We are far from achieved. It's true for Nepal. It's also true for other countries in the region. The second point was that it's not just food production and food preparation where women have a role. They have role in every aspect of the economy and life, and they need greater say, greater involvement, greater ownership and control over resources. Only then inclusive, sustainable transformation will happen. The other message was one of the ways to make systems more equal. There's some policies that can help it, but actually citizens and individuals and families and colonies have to take these actions. And you need to get boys and girls involved and boys and men involved in household tasks, sharing the burden very early in life. That's the only way. The last message here was that we need better communication. This message came up again. We had a policymaker, Dr. Shabnam Shivkoti, and she said that, look, you have to have better communication with us policymakers, and it can be done in certain ways that becomes more useful to us. The last session, the technical session, was on strengthening markets. Here, the focus, a great deal of focus was on trade. So most food comes from trade, and as a result, trade is extremely important. There is the dichotomy between intranational and international trade is kind of false. The two are essentially entwined. A second point was that we tend to think that South Asians are just only care about price points, but just as in developed countries, non-price attributes are just as important and offer key opportunities for value capture and value creation in this whole thing. And time and other physical barriers to trade do impede trade, and as a result, limit consumer choice. There was Dr. Arpita Mukherjee. She presented a lot, and I just picked one, that e-commerce is rapidly growing, but it's not uniform. So ready to eat, and there's certain kinds of food categories where the growth has been much faster than in other things. She also highlighted, plus a few other panelists, that having separate standards for domestic production, imports, and export hurts all three, and it needs to be aligned for a good transformation. She and other colleagues from other countries also identified that governments in the region do not have consistent and predictable policies. So ad hoc regulation, regulatory flip-flops, inconsistencies in how you impose taxes and duties hurt everyone, and including is partly a reason why you have less trade going on in South Asia than comparable countries like China and East Asia. The panelist from Sri Lanka highlighted that she agrees, she's a trade economist, that open trade is good for growth and transformation in the long term, but post-macroeconomic crisis and many other situations, it needs a more nuanced view. Open trade cannot be the only way. She also underlined that in economies where a majority or a large section of population is still dependent on agriculture for livelihood, opening trade is politically fraught, it's politically challenging, and we need to be aware of that. Shahid, who's there, he underlined that we have done a pretty decent job of achieving growth and reducing poverty, but nourishment, the reduction in malnutrition has not been to the same extent. There are a couple more slides. Am I out of time? So where do we go next? The CGI's commitment to healthy diets, nutrition, and healthy both for human beings and planet continues. There are a series of projects that CGIAR and IFPRI and other sister institutions are committed to implement in this region. These include programs that focus on nutrition, but also on environment, trade, and other issues. IFPRI will be turning 50 next year, and we'll be doing a series of programs on this and other key goals of human development and nutrition from this year till 2025. The last but not the least, I want to make a pitch for a program that I am one of the co-leads, meaning I'm one of the scientists working on. We have a program that looks at food systems in South Asia. The idea is to collect high-resolution data and do analysis at high-resolution, gender disaggregated, age disaggregated data. We collected data from all three countries. You saw some of the results in the session where Sam and Derek present. We have, even before publishing our own papers, put the data in public, and we really encourage all of you who are interested in data and evidence to download the data, use it, and come and collaborate with us. We organize a series of webinars, and we have some data products for this. We'll be really happy if you use this data and work with us for analyzing it and informing policies, stakeholders, and decisions. I'll close here. Thank you. Thanks a lot.
Thank you, Dr. Avinash, for recapping the whole day within the 10 minutes. Congratulations. I would like to highlight 3 quick points from the recap of the last day, yesterday. The food ecosystem has been changing very rapidly. So there is a difficulty to choose the right food, nutritious food. So that is there. For the case of Nepal, we have some limitation because of the supply side constraint of some of the variety of the foods that is there. I would like to highlight one issue or agenda over here that I think there is a strong correlation between plant, animal, and human health. So if there is any research or some reference on that, we would be very happy to listen and hear after the Q&A session or any other mode of the discussion. Basically, plant, animal, and human health, correlation or relation. Thank you, sir, again. So I would like to move to the Dr. Atul Upadhyaya, sir. We have a 6 panel member. We have a 60 minutes, so we have to divide principle of equality. So 10 minutes each. I think we all member will agree on that. We have a question to you, sir. Given everything that has been discussed till now, yesterday and till now, what can be done better to improve consumer dietary choices? Improve the consumer dietary choices, basically in rural and urban environments in the context of Nepal. Please, sir. Thank you.
Thank you, Chair, for this question. And once again, thank you, IFPRI and IADS for inviting the Regional Office, South Asia UNICEF to this Way Forward session. In the last few reports that came up, the GFPR, the Child Food Poverty Report, along with the discussions we had yesterday, few things come to my mind. One is, it is very certain that there is a great concern over the severe child nutrition deprivation. That is one. The availability of healthy and nutritious diet, not only in Nepal, but in the region is diminishing. There is a pervasiveness of unhealthy foods everywhere, increasing demand of all these things. That is one. The other thing that comes to my mind is, which I would like to reiterate again, is the failing of the system approach. The food system, the way it is functioning currently, is not functioning properly. That is what comes. Otherwise, we would have better food in our system. So there is an absolute need to transform the food system, the way we are acting. There is no doubt about it. That is for certain. Now, we also know that the actors in this food system, there are various actors, right? So various actors must, should, can play different roles. And based on the roles that they can play, I think there are some roles that I would like to propose that they should be playing to transform the food system so that we can have healthy and nutritious diet. The lead in this, the system, government is the lead, I think, who should be taking the lead in to transform the food system. Now, how can government, what government should be doing is, first of all, they should take lead in developing, resourcing, monitoring the responses, whatever responses we are doing. They should also ensure policy frameworks which would support the mitigation of these challenges, those kind of policy support. For example, having strong policy for the relevant WHO resolutions, ending inappropriate foods for marketing, those kind of things should be there. And finally, the government should set targets and then track progress annually or periodically. Government should do that. That was for the government. For organizations like ours, for development and humanitarian organizations, I think we should elevate the agenda. We should elevate the agenda to reduce the nutrition deprivation and also make it a part of a national goal or a regional goal or a global goal. That should be our job. We should also strengthen government capacities. That is another of our role that we should be doing, so that the policy and programs should be implemented effectively, and also support the mechanisms, so that the global mechanism, the regional or the national mechanisms, so that the monitoring is done properly. That should be our role. And there's another big role of civil society and media. They have another big role. The civil society should advocate for political support. That is very crucial, right? And also on public awareness. That's another part when we discussed yesterday about demand creation of nutritious food. So these kind of roles can be played by civil society and the media. They should also monitor the governments and other partners, how they are working, the civil society and media. They should be doing that as well. And then they should demand the private sector, particularly food and beverage industry, for the compliance. This is what the civil society and media should be doing. Now, there are financial partners also as an actor in this food system. These financial partners should prioritize the nutrition deprivation, the availability, desirability, those drivers that we have been discussing, as their agenda. These are what financial partners should be doing. And they should be committing for financial investments in these kind of activities. This is what financial partners should be doing. And of course, the food and beverage industry. Now, they have a big, big role. First, their policies, their products, their practices. That should ensure with the national policies, with the global recommendations to improve nutritious and healthy diets. That is what they should be doing. They should also be investing in safe, nutritious, affordable, and sustainable food products. That's what they should be investing, whether during transportation, during storage. So those kind of things they should start investing in. And for academic and research institutions, like, say, for example, IFPRI, right? Now, IFPRI has been doing a lot of research work and should still continue. And Avinash explained just now about what they are doing now. And what I would also like to suggest is having data. Now, who are using the data? So what I think is there should be a platform that, like, by data available, to use data to disseminate this data. And also there must be some tools developed by these organizations, right? So a platform can support the countries in the region to use that tool. So these kind of things that the research organizations should be aiming at, to generate evidences, to identify barriers. These are the research gaps that should be done. And the policy research that comes up after from the academia should be translated to actions through policy, right? And there again, yesterday we were discussing on the policy and scientist gap, right? The policymakers and scientific gap. This is where the platform can be a big support, right? And so we need a platform, something like that. And so finally, to sum up everything, we should always have in our mind, children, adolescent, and women should be at the center whenever we are designing, developing, or implementing any program to transform food system. That should always be at the center. That is one. The other is all the stakeholders now should work collectively, be more accountable, make bold decisions, work from beyond the comfort zones. That is also necessary. And therefore, we need to galvanize our actions, our commitment, and accountability. So once we do all these things, I think we can certainly get our targets by 2030. Thank you very much for the opportunity.
Thank you, Dr. Atul. Now we move to the Jamie Morrison online mode. Dr. Jamie Morrison, am I audible to you?
Yes, you are. Can you hear me?
Thank you, sir. The question for you is, given the GAINS mission to improve the consumption to healthier diet for all, especially the most vulnerable group, and its focus to fortification, how can the production and consumption of biofortified or fortified staple foods complement existing nutrition strategies, especially for the vulnerable population. Also, you could highlight some of the lesson learned for the country like Nepal. Please share.
Thank you, Chair, and good morning to everybody. So yeah, I mean, in answering your question, large-scale fortification can certainly be a powerful food systems intervention, and it has a proven track record of virtually eliminating debilitating vitamin and mineral deficiencies in many target populations. It can also ensure that people at all levels of income have a basic level of vitamins and minerals built into their diets, even during periods of stability. And studies have shown that the returns on investment in fortification are amongst the highest for health and development-related investments. Indeed, it's been estimated that every $1 invested in fortification generates about $27 in economic returns from prevented disease, improved earnings, and enhanced work productivity. So the case for broadening access to fortified foods is very strong. But as Panima reminded us yesterday, no single intervention will be sufficient to deliver healthier diets from more sustainable food systems. And this includes supply-side innovations such as fortification. In designing fortification policy and delivery systems, we therefore need to consider the use of fortification in the context of significant policy challenges to reducing the cost of healthy diets, while also ensuring that the achievement of other social and environmental goals, and irrespective of the affordability issues, of the challenges of shifting consumer preferences from nutrient poor towards healthier diets are still front of mind. And we heard a lot of different ideas generated yesterday during the discussion as to how this might be done. But I think at the core is that if we are to achieve healthier diets, policymakers will need to be able to combine or bundle policy instruments in a way that reduces the current policy bias towards the production and consumption of staple cereals, and also better accounts for the true cost of food. We heard yesterday a number of possible levers for doing this. These include policy reforms to incentivize changes to dietary preferences, public procurement systems that incentivize the production of more nutritious food, and also food-based safety nets that make foods more affordable. They're all amongst these approaches. And there is a dimension of fortification that can be built in to any of these approaches. But I think looking forward, we need to put much more focus on how we ensure that interventions to achieve one food system outcome, such as inadequate micronutrient levels, really are supportive of achieving other food system outcomes. At GAIN, we're currently supporting 12 African and Asian countries, including Bangladesh, Pakistan, and India, to achieve healthier diets from more sustainable food systems through our Nourishing Food Pathways program. And a key element of this program is the development of a set of tools which can help governments to improve the coherence of policies and also support them in integrating these tools into strengthened policy decision-making processes. These tools include those that are focused on the generation and use of improved data, and I'll come back to that point in a minute. I think that the previous speaker, Dr. Atul, highlighted the importance of data. I'll introduce one initiative which I think can help take that forward in countries such as Nepal, but also tools that help governments to navigate the complexities involved in acting to improve policy coherence. And we also heard yesterday how the political dimension is critical in taking these sorts of interventions forward. So to briefly give a couple of examples of each type of tool, along with FAO and Johns Hopkins University, GAIN has created a food systems dashboard which can help to identify and prioritize actions. This dashboard allows countries to describe their food systems against almost 300 indicators by reducing the fragmentation of that data within country, bringing it all into one central platform. The tool also helps countries to diagnose where their challenge areas are by comparing the indicators to a series of threshold values. These may be internationally agreed norms and standards around certain areas of malnutrition, for example, or they may simply be averages or different characteristics of the distribution of the data globally. But it gives a very good indication of where countries are falling short across these 300 different indicators, and therefore where countries should be focusing on improving and strengthening their food systems. For example, in Bangladesh, dietary energy from staples, the supply of fruit, the supply of pulses are all identified as likely challenge areas, as are biodiversity loss, water use, and the prevalence of undernutrition. The tool can help countries such as Bangladesh to decide on actions by linking these challenge areas to relevant policy solutions. Now, I think importantly, this work is also being taken down to the subnational level. And this allows much more informed and context-aware interventions. In Bangladesh, this has already been done at the level of 8 divisions and 4 city corporations, and in Pakistan at the level of 7 provinces. And the beauty, I think, of these systems is that they've been built into government data and information systems and are starting to inform food systems policy interventions. A second example when it comes to the use of information is a tool called the Financing Flows to Food Systems methodology, the 3FS, which has been developed by the World Bank and IFPRI to help countries to understand where they are currently allocating resources to different dimensions of food systems. We see a lot of reports coming out annually which indicate how much needs to be invested in food system transformation. But we see very little evidence on whether certain areas are underfunded and therefore unlikely to be achieved, or areas which are overfunded and where there are likely to be inefficiencies in the use of government funds. Often we see different agencies addressing essentially the same topic and both putting money into that and creating inefficiencies. We therefore plan to support the application of this tool in all of the program countries, including the 3 in Asia that I mentioned earlier, but also potentially in other countries such as Nepal, along with our partners, the World Bank and IFPRI. In terms of tools which help navigate the complexity, we're in the process of developing a policy coherence tool, which will be used to identify inconsistencies between different policies in the achievement of a specific set of outcomes. So governments often set priorities, but when we look across different sectoral policies, some of those play against the priorities which have been set by government. And often we talked yesterday about the siloed approach to decision making. These types of tools can help us to identify particular hotspots where there really are policies which are working against each other and can be used to help to strengthen those. We've also been working with IFPRI to develop a political economy decision toolkit, and this can help in the identification and prioritization of potential political economy challenges. And these can vary from, for example, policy stability. How likely is a policy to stay in place for a period of year? How predictable is the use of that and implementation of that policy? But also other issues such as coordination between sectors and coordination between different levels of government. And as well as helping to identify and prioritize those particular challenges, the tool also brings best practice together to help the user to identify how to resolve or to work around those particular bottlenecks. So in conclusion, I think taking this agenda forward, we need much more energy, not just on the specific interventions, but on helping to develop the support of such tools which help government to better identify and navigate the inevitable trade-offs in food system transformation and come up with much more coherent sets of policies to take us forward. So again, thank you, and back to you, Chair.
Thank you, Dr. Jamie Morrison, for your contribution. And now I move to the Dr. Jay Das. I would also like to request try to limit within 10 minutes if possible. Sir, please highlight what are some critical gaps to bridge the policy, program, and action levels to create an enabling environment for healthy diet and set goal for countries' food system transformation. A pleasure.
Thank you. So thank you for this great question and inviting me to this panel discussion. And we all know that there are some critical gaps at all levels when it comes to policies, program implementations, evaluations, and all other sectors. And much has been done over the years, but I think that there's still some basic areas that we are still missing out. And without filling those gaps, making plausible policies and even implementing them to make a change would not be feasible. So one of the things that I've been in this field for over 10 years now and working in various areas, especially in Pakistan, the area from where I come from. I think there are still data gaps that exist at all levels. And even we do have data like we do national nutrition surveys and all of the surveys looking at anthropometry, looking at stunting, overweight, wasting, obesity, but there's not much research done on the food systems and how do they vary between various contexts, even within a country. If I talk about Pakistan, it is such a diverse geography, population, and same goes for many of the South Asian and other developing countries, that even one solutions fit all wouldn't be possible even for a country like Pakistan. So I think researchers need to get together and capture data on how behaviors and other identifiers vary between various contexts and various regions within a country. Because unless we don't fill those data gaps, making context-specific policies wouldn't be feasible. And because this food is so related to, there are so many underlying determinants, your identity, your social identification, your religion, your language, the area that you come from, all of them matters so much that we cannot sit in silo and make a policy without involving all the relevant stakeholders. There have been increased discussion on having some multi-stakeholder partnerships and multi-stakeholder involvement. And in food systems, it would be many different government departments or ministries that could work together, including health, nutrition, agriculture, livestock, education, health. And apart from these, civil society, NGOs, academic partners, I think all of them are so important that we need to have a consensus from all of these stakeholders, because they have their own experiences, they have their own data, which all could be triangulated together to come up something which could be more plausible. But I think one thing that we often miss out, which is the most important stakeholder, is the community itself. And usually what happens is mostly they are just the passive recipients of all the programs and policies that are made, and they're not actively engaged at the very beginning. So I think that is one big missing piece that we have. And if we start, because we had some experiences at a small level, what we saw the benefit of actively engaging community at the very beginning. First of all, you get to know what are the gaps, what are the limitations, what are the apprehensions. And then you also get feedback on what could be the plausible way to come and find ways around those gaps. And more importantly, having this active involvement or engagement of the community is that whatever then you propose, the chances of getting a buy-in and sustainability becomes higher. So I think that's one piece, although it has been giving increased priority over the years, but I think more focus needs to be given to this specific segment, because that's the ultimate beneficiary and the ultimate target of any programs that we have. Secondly, after this critical data gaps that I talked about involving multi-stakeholders, what we see usually, unfortunately, in these contexts is that there's so many programs, there's so many policies. If you read the document, they're all so beautifully written, so beautifully made, and they cater to all the sore points. But when it comes to implementation, I think that's where the major gaps still remain. And it could be, it is due to various factors. But I think first and foremost is the political will and the governance structures, which should be there to ensure a successful implementation of programs which do not exist. And more importantly, these programs don't, although they have a comprehensive background, they have a comprehensive review of the interventions that needs to be implemented, but a monitoring and evaluation mechanism is not given the focus which it should be in those programs. And many of those programs you would see are not even serially evaluated, and there's not a mechanism of feedback and looping back and modifying the mechanisms based on what you capture, based on what you see when the programs are implemented. So I think a greater focus has to be given. We need to learn. It's not that something which is built is casted in stone and it's going to be a perfect solution. We need to reevaluate at regular, frequent intervals to see how we can improve, or what are the errors, what are the things that need to be strengthened. So I think a strong monitoring and evaluation mechanism in these programs, and a transparent, of course, a transparent mechanism needs to be there if we really need to have a change and have the program achieve for which they were designed for. Other thing, what we have been seeing is that although you would see undernutrition has been reducing in each countries, although the scale or the speed at which they are decelerating might vary between, and it does vary between countries. And at that spectrum, you're also seeing a rise in overweight and obesity. And this is for all countries, whether they come from the developed world, whether they come from the developing world, from all the continents. You are seeing a rising burden of overweight and obesity. And we have done serial surveys, whether it's children under 5, 5 to 10, even adolescent surveys. And what we are seeing is there is a rising trend of overweight and obesity. And one thing that we got to know is that there is not much variation when it comes to overweight between urban and rural context, even between various socioeconomic strata. When it comes to obesity, you can see those trends, but overweight, what we are seeing is there are not marked differences. So I think we need to understand it's not about just poverty, it's not just about finances. I think what are the behaviors? Why are they changing so much that you are seeing overweight even in the most impoverished communities or households? And I do travel to the most rural areas of Pakistan. And although those are poor households, you could see the way they are living. But I think one major thing that is missing is the priorities. The priorities of the people are not in the right place. They do spend, they are spending, but all the spending are towards the are not on the right side. They're spending on calorie-rich food. They're spending on sugars. They're even spending on beverages, sugar-sweetened beverages, and other snacks. And children are regularly consuming those snacks, and those are even accessible at their schools, in their neighborhoods. So I think policies need to be made to make those food systems, the food environment in which the community, especially the children or adolescents, are exposed to, because this is the population, this is the age where those behaviors are determined. And also this is the age of opportunity where you can even make some changes. So I think giving a focus to the food environment of this early age could be one avenue where we can have greater impact. And lastly, I would say that unfortunately, with so many things going on in this world, with this climate change, with this escalating conflict, with this inflation, rise of cost of living, I think challenges are going to even increase in the future. And we have to be very preemptive in those approaches and to see how do we cater to the special vulnerable populations, whether it's conflict, whether those are exposed to humanitarian disasters, and the most vulnerable segments of the society. So thank you.
Thank you. Thank you, Dr. Jaidas, for your contribution and also highlighting the very, very innovative part of the report. I would say that the relation of diet and disease, D square. So that is the very, very innovative part of the report I would like to highlight. So now we move to the SDG. To discuss to the SDG, we have Mr. Jason. We are implementing the SDG, and some of the indicators of the SDGs are strongly related to the nutrition and some of the diets patterns. So Nepal has recently presented the third VNR to the high-level political forum in New York. Jason is working in Nepal, so he is very familiar with the Nepal's food ecosystem. SDG highlights one of the major themes that leave no one behind. So this approach is applicable to this discourse also. I would like to request to Jason, with the implementation of the SDG, could you please highlight some of the realistic actions that research program or policy communities that would consider and try to enhance the better approach for the diet and nutrition outcomes, basically in this region and as well as Nepal? Please, sir.
Well, thank you very much. Namaste to everybody here. And thank you, esteemed chair. And thank you to IFPRI and IIDS for organizing this event, inviting me to this panel, of which I'm not an expert, but I'm some. And I think too, congratulations are in order for this new report. I found a few points in here to be, pretty eye-opening. Namely that, globally, 2 to 3 billion people, many here in South Asia, cannot afford a healthy diet. That's incredible. And that more than half of children and 2/3 of adult women are micronutrient deficient. While at the same time, as you mentioned, sir, obesity is rapidly rising, even in emerging and low and middle income countries like Nepal. So these are massive challenges, really difficult ones, new ones to face, and a bit daunting as well, I think. But at the same time, we kind of look to the past, and in Nepal, we see, there's been tremendous progress, in quite rapidly too. And I'm proud that, the United States and Nepal, actually this year, we are together celebrating 77 years of friendship, and in this partnership, we've been able to make incredible strides in economic growth, in food security, and nutrition. And in fact, since 2011 alone, USAID, through our Feed the Future program, has contributed over $181 million to food security, and has reached 800,000 Nepalis and have helped them increase incomes, improve food security, better nutrition, and try to tackle poverty as well. And that's resulted in the prevalence of poverty dropping from 33% to 11% in the areas in which we work together. So that's really, I think, encouraging, and gives me hope that, hey, we can together tackle these challenges that are really difficult moving forward to 2030 and beyond. But on the policy environment, I think one thing that I would kind of highlight about Nepal is 69% of children under 2 consume unhealthy food each day. 43% are consuming at least one sugary beverage, one with added sugar. And meanwhile, about 1/3 of those kids are not having access to any vegetables or fruits. So kind of what this means is you have many children who don't have any access to vegetables or fruits, but do have access to sugary beverages and are consuming those. So that kind of is a bit worrying and helps you understand that, okay, something is off here, not just in Nepal, but globally, where we have better access to foods that are not nutritious than we do, those that we know are healthy. So we've got to do something about that. We also kind of know that I think there's a few different areas where we can focus. So promoting healthy food choices. That's where not only USAID, the US government, but the entire community here can try to focus on embracing a comprehensive food systems approach to tackle this big challenge of unaffordable food and poor diet quality, particularly in marginalized communities. We have to be able to think about national standards on commercially produced foods to make sure that children and families have better access to healthy foods in market. Because right now more are buying ready to eat food from the market rather than growing and cooking those healthy foods that we're talking about. Social behavior change in marketing needs to increase demand for healthy diets and the consumption of diverse nutrient-rich foods. Continued innovation for fortified foods and crops is really important. We have amazing technology out there. We have to use it here and try to make sure that we're thinking about that as we tackle our farm challenges. And then also I think the other big one is markets. So how do we strengthen local food systems and markets? We've got to do a lot to continue to provide access to markets for agricultural products. That means starting with inputs, water, seed, fertilizer, better modern machinery. How do we increase productivity? How do we, again, utilize the technology that we have so that those seeds that we're planting can produce more, that they can tolerate heat and drought and, all these things that we face with climate change. Once they're produced, post-harvest practices, how can we utilize those to produce more? And then think about food loss and waste. How do we produce, or how do we transport those to markets so that folks in marginalized communities can have access to them and that they can be not so expensive? So really, really strengthening that market system is really important. And then I will say empowering women in the agri-food system. Women are at the center here, especially in marginalized communities, and even across the world globally. I would hate to see a peer-reviewed study that compared my food that I provide my kids to my wife's. We don't want to go there. I think we know that that would be more diverse, more healthy, and should be doing a better job. So the more we can put women in the forefront, that we can empower them to make good choices for their families, and that we give them access to finance, income possibilities, and and the foods that they need to give their family in the local market, then we're going to do a lot better. So I think those are the kind of the three areas that I would consider. But I think the future is bright, and working together, we can tackle those. Thanks so much.
Thank you. Thank you, Chair. Now we move to the next distinguished panelist, Mr. Satish Musa. He is in online mode. Because of some technical issues, he will be available on audio mode only. I hope he is listening us. Yes, sir.
Thank you so much. Thank you.
Okay, so
am I audible?
Please, could you highlight some of the areas, some of the issues that, given the geological distribution of the Maldives, what are the challenges that you face for the implementing an effective system for basically monitoring and regulating the food safety concern throughout the country? Please share.
Okay, thank you so much, and good morning. Thank you for inviting me to this panel discussion. Well, I think my question is slightly different from the rest, as it concerns more of food safety rather than food security and nutrition. So I'll try to explain the challenges of food safety in Maldives, and mostly due to its geological distribution. Well, Maldives is an archipelago consisting of 20 administratively divided atolls with over 1,200 islands, of which on about 200 islands are inhabited. So the rest of the islands are used for industrial purpose, for farming, and mostly for the resorts, for the tourism industry. So it's spread across approximately 90,000 square kilometers of the Indian Ocean. And Maldives do present several challenges for implementing an effective system for monitoring and regulating food safety, mostly due to its geographical fragmentation, like I said before, and the resource constraints, some environmental factors, and also due to economic supply chain challenges, mostly due to, again, in transportation, and some coordination issues with regulation, and also some with public awareness and education. Again, like, it's very diverse, and then smaller populations are in remote islands here and there. So focusing on the points that I have just mentioned, I'll go one by one. So first, on the geographical fragmentation, actually, due to the dispersed nature of the islands, it makes it very difficult to establish a centralized food safety monitoring system. But for now, we have the headquarters of the Maldives Food and Drug Authority, where I'm working, like in the food control division, which has the mandate of food safety regulation across the country. So to coordinate with the rest of the country, and mostly we're using the mode of the health facilities. So whether a regional hospital or a health center, where we utilize the public health unit staff or the public health inspectors for the monitoring of food safety. So to establish such a system is difficult, but we have tried using, like, since it's been about 3 years, we have started using a food safety portal, where the food businesses can be registered, and we can give them permits through this online system. But still, a lot of coordination is required among the public health inspectors. And another issue is with the training. So the training the inspectors on these aspects, and where the trained inspectors are not available, we have to send centrally the inspectors to other islands, and therefore transporting them, also the equipment and also samples between the islands, is both time consuming and expensive. And talking of transport, so for the bulk transport of food, we're using the sea route and very minimal, like, air transport. So issue is maintaining the cold chain. So for food, where the cold chain is maintaining a cold chain is required, it is difficult because not everybody are using the proper ways, like not using a reefer container for transport. So sometimes, like, due to that, if the food goes bad, there's no other way but to destroy the food. So it affects the food security as well. And because of this inconsistency in the temperature, and particularly over long distances, we need to have a proper mechanism to tackle this. And on the isolated communities, because they're very far away, especially when we have an alert, a food alert, and if we need to recall some products that are imported, because mostly we're dependent on the imported food. And when a recall is needed, because the islands are very diverse and smaller populations are living very far away, we find it very difficult. So that's another challenge. On the resource constraint that I mentioned before, there's limited infrastructure, especially like laboratories where we can do food testing, and also for the storage facilities where especially the staple foods are stored. So we don't have sufficient storage facilities, I would say, because sometimes due to insufficiency of these storage facilities, some of the staple food goes beyond, like, it goes to a level which is beyond human consumption. So we have to again mostly destroy those food shipments, and that is a huge loss. And in case where testing is required, again, samples have to be taken from those islands and brought into the to central level or to the city to get it tested. So and even at central level, all the testing cannot be done, and sometimes we have to transport the samples to other countries, send the samples abroad for testing. Another issue on, again, resources are the training of the food safety inspectors and the laboratory technicians. So that is another gap. Right now, we are trying to mitigate that by talking with institutes locally to create a syllabus on food safety, at least at different levels, not maybe at very high level like first degree, but some certificate courses on food safety where we can train the inspectors, and also some from the private industry, so that the food business operators can also have some awareness on food safety for the food handlers. Another issue is, again, due to the dependence of the whole country on imports, because a significant portion of our food is being imported. About 90% of foods are imported. So it creates a challenge in ensuring that the imported food meets safety standards. So we often depend on the food safety or the health certificates that are accompanied with the shipments that are imported. And not all the foods are tested for monitoring on a regular basis. And due to that, it creates a challenge for the import food safety, whether it fits safety requirements. Another is for the local food production, like very small scale, scattered local food production systems lacks the standardized practices, and it makes it difficult to enforce uniform safety standards. So the informal nature of these operations leads to unregulated practices. But however, this year we have been very lucky because we were able to ratify the Food Safety Act of the Maldives. That's that's the first act on food safety. So it will give us some advantage on this because enforcement will be easier with a proper legal framework. So we can easily, if we notice malpractices, we can withdraw their permits. So it will be very good for the enforcement of food safety. Another issue is coordination, because again, it's with a decentralized governance in Maldives. It leads to some inconsistencies when it comes to enforcement across different islands, because some local councils and public health units have the mandate of food safety, and they have varying levels of capacity to implement and monitor the food safety measures. So one may not adhere strictly to certain standards while the others may. So to bring a uniformity among them is difficult. Then for that, we need a coordination between the agencies to overcome this issue. And another issue is with the public awareness and education, because when we look into cultural practices, like certain traditional food practices where traditional foods are used, and some communities, they don't feel the importance of shelf life testing, for example. So sometimes we pick certain food items and then do testing on the regulator's side to show them the importance of shelf life testing when they put in the market, the traditional food. And lastly, I would want to talk about the language barriers, but it's not among the locals that we have it, because although some changes are there in the dialects, it's mostly like, our local language, which is Sirahi, and English is also widely spoken among everyone. But the issue is with the expatriate workers. So so who may be working in the food industry, in the food outlets. So we, as much as possible, to uh, try to translate the key messages on food safety into the awareness materials that we produce to make them aware of the food safety informations and also the regulations. So thank you so much. Do you have any questions?
Thank you, Mr. Satish, for your great contribution. So we now move to the Dr. Ashok Dalwai, sir. Could you please highlight in terms of regulation and monitoring, what are the steps that the government can take to ensure safe and nutritious food that is available to all the consumers? And also please highlight some of the example best practices that would be instrumental for Nepal. Please share.
Mr. Chairman, my co-panelists and distinguished participants, good morning to all of you and thank you very much. You have given me a very specific question to answer that makes it very difficult. Nevertheless, let me take the example of India and share with you as to how we can regulate and monitor the quality standards of food. In India, primarily we have three systems or three authorities. The first one, of course, is for the packaged food. We have an authority called as Food Safety and Standards Authority of India, in short, FSSAI. And FSSAI has its legal support in the law, which was enacted in 2006. That's called the Food Safety Standards Act 2006. With this particular act, all the old laws that existed in relation to the food were all repealed. So now we have one conglomerate act. So FSSAI draws its strength from this particular act. The second one is for the non-packaged food, that is agriculture produce. We have what is called a Directorate of Marketing and Intelligence, so inspection, Directorate of Marketing and Inspection, DMI. So now DMI is responsible for quality standards relating to the non-packaged agri-produce. So it draws its legal power from what is called Agricultural Produce Grading and Marking Act 1937. Okay, to repeat, Agriculture Produce Grading and Marking Act 1937. Then the third one is relating to the organic produce. Now, since organic production is also gaining traction, we once again have two sub-laws for that. First one, of course, is NPOP. There is the National Program for Organic Production, NPOP. This was enacted by the Ministry of Commerce and Industries in 2001. So since 2001, we have what is called NPOP. So NPOP standards are more rigorous. They are to be documented. They are to be audited, all by third party. And therefore, the NPOP certified agri-produce becomes fit not only for domestic transactions, but also for global or export market. The counterpart of NPOP, which is simplified, is what is called the PGS, Participatory Guarantee System. This PGS was adopted by the Ministry of Agriculture and Farmers Welfare because we felt that since we now want to take up organic production on a large scale, then most of our farmers would not be able to afford a third-party inspection. And therefore, we have what is called a voluntary or self-certification process. So here some NGOs or some local authorities guide the farmers, and those guidelines standards have been laid down by the Ministry of Agriculture. And PGS certified produce is not allowed for export, but it is only meant for the domestic consumption. So in short, we have these three authorities. Now let us discuss a little more about the FSSAI, because a lot of commodities are now coming to be packaged. So now let me share that under that different rules are adopted. So one rule is very important, Food Regulation 2020, now that is number 2027 of 1970. So it deals with export inspection requirement for food products. So anything to be exported, it takes care. Then it takes care of labeling on container of the packed food. So labeling is very important. I will share a little more on labeling. Then license to keep shop of or carry on wholesale business. So anybody who wants to enter into business, whether it's wholesale or retail, then you obtain a license from the local authorities. For example, it could be the municipal authority in a city. So there are different authorities, but license is very important. Then fourth one is restriction of use of color, because color is one thing that really carries a lot of problem, toxic for the consumer. So there's a restriction in the use of color. And simultaneously, there's also restriction in using preservatives in food products. So this particular Food Regulation 2027 is very important because it talks about what generally the consumers are concerned with. Now, let me share with you a bit about the label. Now, whether it is agriculture, in agriculture sector, for example, pesticide, they also have a labeling system. Then the human consumption commodities, naturally there'll be a labeling. So what does this labeling mean? So basically the wrapper on the container, on that we are to have a label, and label is to carry certain information. So there are a lot of things, so I would prefer to read lest I miss them. One is that it has to carry the trade name or description of the food item. It has to say very clearly what is the food item inside. Then second one is list of ingredients. Unless it is a single ingredient commodity, multi-ingredient commodity must list all the ingredients. Third one is net content by weight. Fourth one is distinctive lot number or code number or batch number, so that we can have a track and trace. Fifth one is the date, month, and year of manufacturing and packaging. Sixth one is best before date. You must have seen all it is produced, best by so-and-so date. Then seventh one is instructions for use, how to use. Eighth, maximum retail price. Ninth, nutritional information. 10th, energy value in kilocalories. 11th, amount of proteins, carbohydrates, condiments, etc., etc. Then 12th is numerical information on vitamins and minerals. So, as you see, the label is supposed to carry so much of information. In our country, we find the challenge in what language this label will be there. Given that we have got, in Constitution itself, by now 18 languages are recognized. And apart from that, there are so many other languages. So it's always a challenge. And then since everything must be put in every language, it becomes micro, letters, it becomes very difficult to read. So there are always concerns, complaints relating to the language, but nevertheless, this is what we're supposed to mention. Okay. So as I said, FSSAI takes responsibility for food standards, labeling, and packaging. Presence of metals, heavy metals particularly, are very important. Registrations and licensing, it takes care of. So there are challenges, and let me share some of the challenges. First is that, like any organization, it suffers from manpower shortages. Adequate number of laboratories are not there. When you want to maintain, yes, you lay down the standards, but then whether those standards are being really adhered to, so you need to take samples from time to time, then to test them in the lab. So those facilities, that infrastructure still needs to improve. Okay, then second one is enforcement becomes very challenging given the vast size of the nation and the number of commodities that we produce or package. So you require proportionate manpower, proportionate infrastructure. So that is really the second challenge. Third one is infrastructure, as I told you, could be for food testing, inspection required, etc. Then more important is consumer awareness. See, all these days, people are not concerned so much. But with now, the awareness is growing. But yet, we need to create right information in them. awareness means what? They should be told, okay, you have to demand this. Like I read about 12 items that should go on the label. So the consumer must be aware of this. And today, to support this at the district level, we have the consumer authorities. Now they are nearly 30 years old now. So the consumer authorities, where the citizen can file a complaint regarding any of the services, not just about food safety, but any of the services, a consumer has authority to go to the district authority. There is a autonomous body under normally a retired district judge, and it has members drawn from civic society, etc. Or to have that authority. Then adaptation of technology is very important. Today, I think digital technology, including the emerging suite of artificial intelligence, etc., they need to be incorporated, integrated wholesomely. So these are some of the new challenges. So FSSAI has a lot of responsibility. It has its regional offices at 5 centers like Kolkata, then in Tamil Nadu, Andhra, Mumbai, etc. But then we need more of them. Now, let me come to the DMI. See, Directorate of Marketing and Inspection. Now, FSSAI works under the Ministry of Health and Family Welfare, whereas DMI works under the Ministry of Agriculture. So you see the challenge now. So the Directorate of Marketing and Inspection is responsible for agriculture markets and laying down standards of the agri-produce to be transacted at the markets. Now, we have got APMCs, Agriculture Produce Market Committees. So it lays down standards. And simultaneously, it is supposed to undertake inspection, test these samples, and then, of course, there's a provision for penalty, as I told you, under the Act of 1937. So now DMI has got that authority. Now, the two things, there is always a challenge. So the good thing that now the government of India is contemplating and has taken some steps is, can we merge the two responsibilities? So since Agriculture Ministry is looking at both now agriculture produce grading and marketing, they said, all right, you look after only the marketing aspect, the grading and laying down standards for the agri-produce, even non-packaged, can be transferred to FSSAI. So that process is underway now. So there's one good example I wanted to cite from India, that I think many countries, particularly South Asia, we're all cousins only, all of us there's not very little difference. So these challenges of coordination and cooperation among multiple authorities must end, because two ministries will be fighting with each other most of the time. So now the committee has taken a decision that will transfer this inspection of agri-produce also to the FSSAI. So FSSAI becomes more strong, and then we will be able to focus on marketing aspect only. Then the third one, I told you about this organic produce. There is a lot of spuriousness also, Many times they just label it that way. So a lot of inspections required. Now, the NPOP, so we have laid down that at the state level, they should set up authorities, and simultaneously at the district level. So NPO and a lot of private entrepreneurs, with knowledge and skill are setting up their business avenues to provide the service under both NPOP as well as under PGS. So these are some of the systems that India has got. But I can only tell you that still we are not up to the mark. Okay, we really need to improve, but we are now slowly and steadily seeing the awareness about the standards. See, I think it is the middle class which sets that kind of an environment. In India, out of 1.42 billion population, you take any category, it is a substantive number. Okay, we have poor people, substantive number. Rich, substantive number. Super rich, substantive number. Middle class, super substantive. Today, India, the middle class counts at 300 million. All right? That means it is little less than the total population of the United States. Right? Okay. So 30 million, people, 300 million, sorry, now they've begun to demand quality produce. And naturally, that awareness will trickle down. And I'm sure that we will now start responding. So this is the system that we have. And now what Agriculture Ministry is doing is adopting digital technology in a very expansive manner. We have now built, for example, we are building rather, what is called a digital database of the farmers. We call it a registry. There's a difference between database and registry. A database can always contain non-authenticated data, but a registry contains the authenticated data. For example, we have got 120 million farmers in our country. Now we want to collect the database of all these 120 million. The first phase, it will be 50 million. So their names, demographic data, their Aadhaar number. You must be knowing that India has got the unique identity number, which is a biometric number. So Aadhaar number, then their bank account number, and more importantly, the land details. So all the latitude, longitude, the coordinates of the land will be also coming into their time. Okay. So now with that database, we'll be able to track and trace the quality that he's going to produce. Okay. We don't have that system. So once we have this registry, we'll be able to do it. So I will stop here. I've already taken a little more than 10 minutes. Thank you so much.
Thank you, sir. Thank you for your contribution. So we have a 10 minutes time for Q&A. I think we are running out of time. So 2 questions. I would like to request just 2 questions. Please, sorry, you first and then one more. I have maybe 3. Yeah. 1, 2. We have to balance. So 1, 2, and then 3. Okay. We start from this side, sir, please.
Thank you. Thank you. I'm Dr. Zaidi Sattar, Chairman of Policy Research Institute in Bangladesh. In the December report of WTO Trade Policy Review Body, they found that countries around the world have been increasing trade restrictions, particularly on food, feed, and fertilizer, the 3 Fs. Now, economists have spent a lot of time researching the positive impact of trade openness on growth, poverty reduction, job creation, export performance, and all that. Now, has food policy research done that linkage between trade openness and healthier food systems? Is trade openness or trade restrictions going to be better for healthier food systems? This is my question to any of the panelists who might want to address. Thank you.
Thank you, sir. We will take all the questions and then response, please.
Thank you so much for the time. I'm Ali Sananyopane, ADRA. So I have one query to Dr. Ashok. Thank you so much for your insight regarding the food regulation standard and act in India. You highlighted so many things, and out of them, like the labeling of pesticide residue. That is, when we talk about this healthy diet and nutrition, the residue of pesticide is quite important. So how you are monitoring those things? You are just highlighting those things, or how many pesticide you are testing? That is one concern. And another is, you mentioned you have like a database of the producer. Then there is a land detail as well. Is that only the land detail, or you are also recording the cultural practices? That is one question to Dr. Ashok. And another, my question towards the Dr. Avinash and Dr. Toyanath Gyamali and Mr. Jason as well. So that is particularly related on the transformation of food system. When we talk about the healthy diet and nutrition and transformation of the system, then we always neglect the smallholder producer. So what might be our policy, strategy, and plan so that we can link those smallholder producers into the global or national food supply system, so that the people have access on healthy diets and nutrition. If we talk about global scenario, more than 75% they are the smallholder producer. Even the situation is same, or the proportion might be the more in South Asian region, even in India, Nepal as
Could
well.
you please
Thank you.
summarize your question, sir, please?
Thank you so much. My second question is how we can link to the smallholder into the global or national food supply system. What might be our strategy, policy, and future plan? So that's why I'm asking from the perspective of national planning commissions and from the donor perspective, and if we might have the experience on it. Thank you so much.
Okay, maybe I should just make some comments rather than questions because we have a lot here. So I was just going to respond, Jason. I think you made an interesting point that if women feed the kids are going to eat better. That's probably true, but I think we should also try to get the men to do a better job of providing nutritious food. And probably Purnima could speak to that, as that's something that she's looked at as well. On trade, my comment was, I think it's, we know that the WTO has a lot more rules on imports, right? On the tariffs that countries impose on imports coming into their country. They have very little rules actually on the export side. So countries can impose export restrictions quite easily. There is an exception there's supposed to be an exception for food products, but that has never been actually agreed to by WTO members. There is an exception for humanitarian aid that can still happen during export restrictions. And we've seen the impact of export restrictions on food and fertilizer products, from the sanctions. But also India has imposed export restrictions on rice, which have led to a significant increase in the price of rice for many countries. So just to make that comment. Thank you.
Okay.
Thank you. So my question is to Mr. Zalvi, but it generally will apply to all the cases. So this is something about, with the FSSAI. So I was pretty happy to see that at least you're moving into the fresh product space, which was like, everything was not going to be just going to be. So that was one, but I don't know, how do you really integrate these two systems? But there's a larger question is about, your grading certification system or labeling that, you're talking about to FSSAI. I mean, you will have to think about how many, even if your middle class is getting to 300 million, how many people actually even care for the FSSAI certification. And this is also related to the way that the information is given in those certifications. It's about, when they do, and take the example of dairy, when FSSAI comes up with these test results and they present it, they're saying that we tested it in Delhi, we tested in Bihar. Delhi, 70% of the milk is contaminated. And I come from Bihar, so I don't have a choice problem. 100% of milk is contaminated. So that's, but the point is the consumer does not know which brand should I go to, right? And if you're so the point is that, there can be only two reasons for doing so. One is that if, the agency itself is not very confident of the test, that they can be sued for whatever they are presenting to the public. And the second is it could be used as a lever for power. Because you have this information rent that, which I saw, and I'm not going to really divulge that, but I saw it firsthand that, if you don't do this, we can divulge your name. So on. So these are the two reasons because of which presenting that information is not going to be effective in terms of improving the outcomes on food. And this will apply to all countries. How do you present information? Like when Sri Lanka had this melamine problem, which I call the other melamine after China. So they published it saying, oh, Fonterra milk has this problem. Then the consumer responses, and we have, I don't have my Sri Lankan colleagues and co-authors, but we did a paper on that to see how did the consumers respond when the information was provided, how did they adjust. So I'm saying there could be some guidelines on how do we really steer this information system in order to deliver on safety? Thank you.
Great. Well, thank you so much for the questions. Charlotte, I couldn't agree with you more. Great point there. We all need to do much better here. And I think a lot of it, again, is, the policies and regulations that allow better access to nutritious foods in the market, more information to understand, nutritional labeling and other things to make those good choices. At the same time, in Nepal, we've got a lot of men who are leaving the country to search for other work, and there's a lot of women there who we as donors and others want to focus on and better empower. So that is still important. Sir, to your question, I bet you are quite knowledgeable in the subject and more than I am, and I also bet there's a lot of research out there that's done. But off the cuff, I guess, boy, nutrition is a bit of a complicated subject. Jai, you mentioned wealthy countries, high obesity and nutrition problems, poor countries, also struggling with different aspects of that, but also obesity and other things too. So it isn't quite so straightforward, but generally speaking, I understand that having trade agreements can better improve the ability to, say, export products from Nepal, for example, to other countries and find those markets. And as Bangladesh and Nepal approach least developed country graduation in 2026, finding those markets beyond those that have preferential access are really important. Attracting investment for business, for things that those countries do well, so that they can export those things and and bring more money into the country is gonna be really important to be able to afford that healthy, nutritious food. So I think, in the case of Nepal, where there's specific things that they have a competitive advantage, in South Asia in general, where you have, a large, 300 million in the middle class, that's tough competition. So you have to find what you do well, hopefully have trade agreements and other markets to be able to export those, get money in the country, and then, combine that with a policy environment that provides access to and better knowledge and more demand for nutritious foods and better diets. That would be an off-the-cuff answer.
Yeah. Okay. I will take the questions on pesticide regulation and how do we integrate ourselves into the global supply chains. Honestly, I couldn't, hear properly, but I guess this is what it is. And of course, Dr. Devesh has, not as a question, you made good comments, and I fully agree with you. So now let's talk about pesticide regulation. See, we have an act called as Insecticide Act 1968, which is in need of total overhaul. And that has been pending before the parliament for a long time, but we will soon have a more comprehensive, progressive regulation act, which will be called pesticide management. So the focus would be on management and not just on regulation. Nevertheless, under this act, first is registration of any new compound, okay? It is subjected to a lot of tests. We have there to produce a lot of data relating to its toxicity, packaging, storage, stability. All right. So normally all that data is generated by them. Then more than 2-season test data is generated by them. That is submitted to the authority. And we have got what is called as a pesticide regulation authority. So they register. That means they say, okay, only after it is registered, then they get a license from the state governments, because licensing authority, the state governments. So both registration and licensing are very important. Now, how do we ensure that these pesticide regulation standards are being adhered to? So we have large number of laboratories under the central government as well as the state governments. And then we have a hierarchy of labs. So there are reference labs also. So that the concerned person can appeal against the decision of a particular testing lab. So there is a system, and every state government under the agriculture department has got a regulation system. There is a directorate. So they are supposed to be inspecting the shops and all other service systems. So that way the things are taken care of. But once again, let me tell you that system is not as perfect as it should be. We need still larger number of labs because I see so many cases keep pending at the labs. Okay. So system is certainly more important. I think now with the new pesticide management bill that we have, things would be better. There also, you should know that farmers, they don't know how to dispose of the containers, for example. And it all contains toxicity. And we need to have a system of management of waste, just as solid waste management or liquid waste management. We need to have a proper management of this disposed containers. So there are lots of issues relating to this, and they may not be using the correct volume. For example, the ICAR, our agriculture research system, or the State Agriculture University would have recommended a particular dosage. But what we find is that they're overusing it, leaving pesticide residues. So pesticide residue is a big challenge. In fact, India has standards are very high compared to many of the European countries. We have laid down very high standards. Okay, that means the threshold levels are very high. And even then, many European countries, US, tend to reject our commodities. So as you know, in global trade war, more than the tariff, it is the non-tariff barriers which have become more important today. So under some technical issues, there would be rejecting your commodity. So we had a lot of issue, for example, or white fly in case of mangoes. Okay, a lot of export happens to US, and US has very strict regulations. So they would come and say that it is rejected. They used to come here to India to inspect. All right. Now we said, all right, then we'll also come and inspect there, Yeah, sorry. So, but anyway, our infrastructure is being improved. For example, radiation facilities, because radiation is very important. Hot water treatment plants. So we will have to certainly put up all these facilities. We have put up now, and they are increasing. That is about pesticide. And briefly about supply chains. See, our countries first must improve their agri-logistics, because a value chain or a supply chain is possible only when we're able to link the farm gate with the demand center, both in near range and far range markets effectively. So that calls for appropriate agri-logistics, including storage, dry storage, cold storage, dry transport, cold transport like reefer vans, and seamless transfer of commodities from the land to the vehicle, vehicle to the train, train to the air, air to the water. So the seamlessness is possible. Only when we can do these things, we'll be able to integrate to the global food chain. And more important is adhering to the global standards. There are global standards, and simultaneously, the plant quarantine facility, the sanitary and phytosanitary standards are there. So Europe, US have got this specific standards. So we must be able to adhere to those standards. And that is possible when you educate the farmers of the importance of the quality, because he tends to compromise the quality. And for that, you again need track and trace, so that if a lot is rejected in some country, we in our country are able to track that particular farmer where this produce was below standard. So I think this is the way that we can actually go in for. Okay, thank you very much.
Thank you, sir. So we are at the conclusion of this session. So I would respond my questions and my remarks maybe within 3 minutes. As per the schedule, there is a 10 minutes. I will cut to 7 minutes. So I will only take 3 minutes. Once again, thank you. Thank you very much, all the distinguished panel members, all the distinguished participants, for your very, very encouraging contribution, thoughts, ideas, strategies, and new knowledge. So we really appreciate. There is, as per the schedule, there is a conclusion from the chair. So I have not a long list of conclusion. I will just touch some of the questions and then way forward. Two ideas. On the question side, I would like to request that there is not negligence or neglect or there is a discrepancy on the small holders. There is not that things. I would say I would request that as per the government policy, as you go through the 16th plan or STS strategy or the action plan of the SDG implementation, there is the equal treatment for all the targeted groups or all the communities, all the stakeholders. If there is anything that have to correct, the public sector government is ready to correct that idea or intervention. That is my first request to the distinguished colleague who raised the question. As per the discussion up to now, I would like to highlight some of the 5-6 areas that is very, very encouraging for us, for the government of Nepal, for the way forward or best practice to the of the neighboring countries. The first one is how to address the malnutrition and diet-related disease. This is a first area we have to work further. There are some high-level officials from the Ministry of Agriculture I am seeing, so we will work together. This is the first area. The second is promoting sustainable agriculture practices. There are some challenges because of the climate change. We have some strategy under the SDG 13 climate agenda. We have to work on that. This is the second. And third is ensuring economic incentive and how to enhance the proper market access. This is the third I would like to highlight. From our discourse or discussion, the fourth is strengthening food system governance and policy integration. There was a question of the isolation, different actions from the different ministry department, not a good coordination. That was the question from the panel member also. And then there are some limitation or gaps on the R&D and innovation side, basically on the agriculture side. This is the fifth one. And the final, addressing the social equity and inclusion on this discourse. So these are some of the areas we have to work further with the different ministries, different research institutions, and all the stakeholders. So because of the time pressure, I will stop here. And finally, I would like to wish to extend my gratitude to all the panel members, to all the participants for your time and contribution. And finally, I would like to thank IFPRI and then other stakeholders engaged on this conference. Thank you. Have a good day.
I thank the chair and the panelists for thought-provoking, eye-opening, and impactful session on the way forward. We will now take a break for 5 minutes and return for the final session. I request everyone to get their teas and coffees inside the hall. Thank you.
Bye. Hey.
We are beginning our final session shortly. I request everyone to be kindly seated, please. I request the volunteers to kindly get everyone inside the hall. We are now at the final session of our event. Our Honorable Minister, Mr. Ramnath Adhikari, could not join us today due to some important meeting at the ministry. Apologies for the inconvenience. Our special guest, Mr. Sanjay Vijay Sekara, Regional Director of UNICEF Rosa, could not attend due to some changes in his schedule and has requested Dr. Zivai Murira, UNICEF Rosa, Nutrition Advisor, to attend on his behalf. Now, for the closing session, I would like to invite our dignitaries to the stage. Please join me in welcoming our chief guest, Dr. J. Bahadur Tandon, member of Nepal Planning Commission, Government of Nepal. Chief guest, Dr. Zivai Morira, Nutrition Advisor, UNICEF Rosa, and Ms. Isabella Kozil, Deputy Director General, ICIMOD. I will now request Anisha to come and felicitate the stage, please. Thank you, Anisha and Nikki ji. Now, please join me in inviting our special guest for the remarks, Ms. Isabella Kozil. Ms. Isabella Kozil has served as Deputy Director General of the Kathmandu Headquartered International Center for the Integrated Mountain Development (ICIMOD) since 2021. She is the first woman in ICIMOD's history to hold the position of Deputy Director General. Ms. Isabella oversees the programmatic portfolio at ICIMOD, led the development of the organization strategy 2030, Moving Mountains, and the formulation of the medium-term action plan 23 to 26, and is committed to increasing the pace at which the organization delivers concrete impacts. Prior to joining ICIMOD, she worked in the multiple leadership and management positions in various international organizations, focusing on the interconnected risks of climate, biodiversity, environment, and development, primarily for the Global South. The floor is yours for 5 minutes, ma'am.
Okay. Good morning, Chief Secretary, distinguished guests, and all experts who have shared their insights yesterday and today. It is indeed an honor to address this august and important gathering that closes the South Asia regional launch of IFPRI's 2024 Global Food Policy Report. There's clearly an important momentum in this room this morning, and it's no doubt because those of us who are here are all strong believers in the need to transform our food system. And evidence from this report points to a lot of work that we have ahead of us. For South Asia, we must work with our governments, the private sector, and communities to address the enormous challenges that face the agriculture and food sector in an increasingly uncertain future. This must include allocating more resources to promote the sustainable production and consumption of more healthy and nutritious food. As whilst it's promising to see the reductions in the prevalence of undernourishment and stunting in children under 5 years in Nepal, it is also worrying to see the increases in the percentages of increased blood pressure and overweight in adults. So at IFPRI, where I work, that's the International Center for Integrated Mountain Development, our studies confirm that across the Hindu Kush Himalaya mountain region, 1/3 of the population is food insecure. Local production only fulfills 40 to 50% of food demand in this region, with about 70% of households moderately or heavily dependent on external food supplies. This dependency, whilst increasing over time, also has negative repercussions on children and women. 35% of women between the ages of 19 to 49 face anemia in this very region. And the changing demographic and rapid outmigration of youth has also led to significant agricultural labor shortages. But as the ravages of the triple planetary crisis hit the Hindu Kush Himalaya particularly hard, such as the higher than average temperature increases that face the mountains, the erratic weather patterns, the water shortages, or either too much or too little water, biodiversity loss and air pollution. Many of the solutions we have worked on for decades will be simply rendered inviable. In short, climate and environmental change threatens our food systems and the multiple development goals linked to sustainable food system transformation. So we need to think and act differently, as you, of course, have discussed over the last 2 days. But there are a few things we would like to stress from the perspective of the mountains. The importance of investing heavily in innovation, but the kind of innovation that blends the best of indigenous and traditional with modern science, so that we can deliver the kinds of green, inclusive, and resilient solutions that are fit for a very rapidly changing context. We also need large-scale policy and institutional innovation and change, new guidelines, new standards, and of course, economic incentives that will enable and support the scaling of more future-fit solutions. Take the example of agriculture in the mountain province of Gilgit-Baltistan in Pakistan, where large swathes of land have been left unirrigated precisely because the water sources that used to feed the irrigation canals have shifted. Here, we work together with local communities and the local government to have to develop the Hydro Ram pump, which is a self-actuating river water lifting pump that lifts the water from a position near the water source to a higher location. This has enabled many communities to irrigate land that was previously rendered not fit for agriculture. Or take another example of Jomol, closer to home here in Nepal. It's a traditional homemade biopesticide and biofertilizer, quite extraordinary in that it can deliver both these two functions at once, and that it can be made up from locally available inputs. Whilst it might not be quite as effective as chemical inputs, it can still cut farmers' expenses down significantly. I must admit, I've used Jomol in my own vegetable garden and found it to be only moderately effective, but that should not mean that we don't research into these kinds of technologies further and build on the best of traditional and indigenous science whilst improving it with modern scientific techniques. Also, at our Living Mountain Lab in Godavari on the fringes of Kathmandu, we are finding ways to improve farming practices so that farmers in the mountain region can get more produce from their land. This lab is our hub to test and scale, to demonstrate and pilot, and most importantly, to pass it forward across Nepal, but also to other countries. And of course, we always welcome you at our Living Mountain Lab in Godavari. And finally, as an intergovernmental knowledge center at IFPRI-South, we are working across our 8 Hindu Kush Himalayan countries to ensure that mountain communities and the food security insecurity that people face is on the agenda of our key stakeholders. Through our expert colleagues and strategic collaborations, we are also challenging ourselves to do much more to take this issue to a global level. So I hope my speech and these examples show that there are innovations that are possible to develop and deliver to those people who need it most, and that these challenges are also presented with important opportunities that lie ahead of us. I would like to thank the International Food Policy Research Institute and everyone in this room for your valuable time. Thank you.
Thank you, ma'am. I now would like to invite Dr. Moreira for his remarks. Dr. Zivai Moreira, Regional Director for Nutrition at UNICEF South Asia, has significantly advanced research on anemia, micronutrient deficiencies, and maternal and child health. His work spans diverse populations, including Sierra Leone, Morocco, and Mexico, utilizing approaches like machine learning and focused ethnography to improve health outcomes. Dr. Zivai's contributions are instrumental in shaping effective nutrition programs across the region. The floor is yours for 5 minutes, sir.
Good afternoon. It's a great pleasure to join you this afternoon. My name is Zivai. I'm here representing the UNICEF Regional Office for South Asia Regional Director, Sanjay Vijay Sekera, who unfortunately could not make it today, but he sends his warm greetings and best wishes to you all. Honorable Dr. Jay Tandon, member of Nepal Planning Commission, Dr. Shahido Rashid, Director, IFPRI, Dr. Biswa Gauchang, Executive Director, Institute of Integrated Development Studies, Ms. Isabella Koziel, Deputy Director General, International Center for Integrated Mountain Development, partners and colleagues. I'm delighted to be here with you. This week, we have been celebrating World Breastfeeding Week across the world. And it's important to remember the untapped power of breast milk as a key pillar in the food systems transformation agenda. While we talk about food systems for healthy diets and nutrition here today, let's remember breast milk is the first food and a key part of food systems. Colleagues, a few months ago, I traveled to Janakpur in Madhya Pradesh province in Nepal. It's an area burdened with one of Nepal's highest levels of malnutrition. At the Madhya Institute of Health Sciences, I met 15-month-old Rayansky and her mother, Babita. Babita had brought Rayansky to the center 2 days earlier because Rayansky was suffering from severe acute malnutrition. When I met her through 2 days into a treatment, she was already improving. What also really moved me, Babita, Rayansky's mother, was trained in early childhood development. And while she was in the hospital for her daughter's treatment, she was also teaching other parents how to play and engage with children, but also advising mothers on how to grow nutritious foods within their home gardens and to minimize buying ultra-processed foods from the supermarkets. This is just an example of local actions at these local levels, which are a critical part of the conversations you've been having in terms of transformation of food systems. At UNICEF, we are very proud to be associated with IFPRI and other partners here today in our shared commitment to advance children's right to nutrition for children like Rayansky and the millions like her in the region. We are proud to be working with you all towards the 2030 SDG agenda in South Asia to improve nutrition for children, girls, and women. As the findings of this year's IFPRI Global Food Policy Report make all too clear, malnutrition in all its forms remains a challenge in our region, and children, adolescent girls, and women are disproportionately affected. We know this is because food systems are failing children and they are failing their families. Today, poor quality of diets is the single most important driver of child malnutrition in all its forms, be it undernutrition, micronutrient deficiencies, or overweight and obesity. UNICEF's own global analysis of child food poverty, which is dietary deprivation in early childhood, finds that around 1 in 3 children under 5 in South Asia consume 2 or fewer of the minimum 5 recommended food groups. This means they cannot eat the diet they need to grow optimally. Food systems are also increasing the availability of nutrient-poor, unhealthy, ultra-processed foods and sugar-sweetened beverages, increasing the risks of overweight and obesity and non-communicable diseases. Data shows that in Nepal, children who are eating fewer than 2 or less food groups are now increasingly consuming unhealthy foods and sweetened beverages. What is at the core of every child's health and well-being is their right to nutrition in early childhood. So when we come together to transform food systems that are failing children, we need to ensure children's right to nutrition is at the center of this agenda. We need to improve children's access to diverse, nutritious foods, improve their food environments and their food practices. We also need to prioritize the diets of children, girls, and women in the National Nutrition and Development Goals. And we need to target the aggressive marketing of these nutrient-poor, ultra-processed foods and make nutritious, diverse, and healthy foods the most accessible, affordable, and desirable option for families. And we need to hold the food and beverage industry accountable too. Despite the grim numbers and the failures, there's reason for hope. We know that positive change at scale is possible. Diets can be improved. In South Asia, we have a very positive story. South Asia has the highest percentages of children who are exclusively breastfed in the world, with 60% of our children under 6 months getting the optimal nutrition they need to survive and thrive. This shows that when we come together and mobilize required actions, we can create change. To end the dietary crisis for children and girls and women, we need to drive systematic action, starting with strengthening the food system, but in concert also strengthening the social protection systems, strengthening the health systems so that we can improve children's access to and consumption of diverse and nutritious foods. When we put children, girls, and women's nutrition at the center of the food system transformation agenda, everyone wins. Children win, adolescent girls win, women win, nations win. Thank you, colleagues.
Thank you, Dr. Morira. Ladies and gentlemen, please join me in welcoming our chief guest, Dr. J. Bahadur Tandon, member of Nepal Planning Commission, Government of Nepal, for his remarks. Dr. Tandon has earned Doctor of Public Health in 2003 from National Institute of Public Health, Japan, and Master of Public Health, Primary Health Care Management from Mahidol University, Thailand in 1991. Dr. Tandon has over 25 years of experience in technical and vocational education and training, TVET, and health sectors in Nepal. He has worked at various levels of senior positions, including Member Secretary, Executive Director, and Director in Council for Technical Education and Vocational, CTVT. Dr. Tandon has been member of Nepal Planning Commission since 2024. The floor is yours for 10 minutes, sir.
Good afternoon, everybody. It is my great pleasure to be here to speak some few words. Shahidur Rashid, Director, Southeast Asia, IFPRI. Ajab Bella, Director, Deputy Director General, ICMOD. Jibai Maria, UNICEF Regional Director, and IIDS Executive Director, Vishwas Gauchan. And different various distinguished dignitaries, fellow participants from different countries, ladies and gentlemen. As we came to this close of this remarkable event, I would like to extend my deepest gratitude to all of you for your active participation and engagement in launch of IFPRI 2024 Global Food Policy Report. Your presence here today is an indication to our shared commitment to transforming food system for the betterment of the global health and nutrition. Furthermore, on behalf of Nepal Planning Commission and on behalf of Government of Nepal, I would like to extend my warmest appreciation to the International Food Policy Research Institute for hosting this important event here in Kathmandu, Nepal. It is an honor to me to be invited as a guest honor especially to speak on such important topics. This year's Global Food Policy reports focus on the theme of food system for healthy diets and nutrition, explore various strategies for improving diets and nutrition by addressing both the demand and supply aspect, along with enhancing governance. These issues are global significance, but they are also particularly relevant in the context of Nepal and South Asia. As I pointed out by the two most important national body of SAARC and BIMSTEC. As the recommendation made by the Global Food Policy Report, we must remember that the choices we make today will shape the health and the well-being of our nation for generations to come. In the context of Nepal, with the diverse geographical ranging from the Tarai Plains to the Himalayan mountains, present unique challenges and opportunity for developing robust food system. Our agriculture heritage is rich, and our journey towards ensuring food security, healthy diet, and proper nutrition for all is still ongoing. In Nepal, we must prioritize diet as a critical entry point for tackling all forms of malnutrition and diet-related non-communicable diseases. Prevalence of diet-related non-communicable diseases has increased by 3 times between 1995 to 2023. Within 2.5 decades, it is increased 3 times, 6.5 to 18.5%. Despite significant progress in recent years, malnutrition remains a critical issue in Nepal. According to the recent data, children under 5 stunting affect nearly 25%, underweight 19%, while wasting and the malnutrition remain alarming by 9%. Obesity and the overweight among different age groups are significantly increasing. These numbers are not just statistics. They represent lives at risk, future in jeopardy, and the community hinders from reaching their full potential. The reason behind these figures are multifaceted. They include limited access to diverse nutrition food, poverty, insufficient healthcare services, and inadequate maternal and child healthcare practices. Additionally, climate changes poses a ever-growing threat impacting crop yield and the food production system, further exacerbating food insecurity. The food environment in Nepal is undergoing dramatic change due to the urbanization, rural transformation, and associated shifts in consumer preferences. These environments are increasingly catering to the growing preference for ultra-processed food, while the availability cost of fresh nutrition food is affected by long supply chain, seasonal variability, and the limited infrastructure. Or indigenous crops like buckwheat, millet, barley are nutrient-dense, climate resilient, and adapted to local agroecological conditions. Promotion and consumption of these crops can diversify diet and enhance food and the nutrition security. Transforming Nepal food system is complex undertaking that requires diversification of agriculture, improve agriculture practices, nutrition and the education, strengthening supply chain, strong policy and governance, community involvement. In order to achieve these goals, we must work together with government bodies, non-governmental organizations, private sector, partners, and the international agency. Each stakeholder has a role to play, creating an environment where nutritious food is accessible, affordable, and desirable. Let us envision a future where every child and citizen in Nepal grow up healthy and strong, where no family worries about their next meal will come from, and where your agriculture practices sustain both people and planet. The vision is within our reach, but it requires our collective commitment and passion. Let us use this platform to share knowledge, build partnership, and inspire action. Together, we can transform Nepal food system for healthy diets and nutrition, ensuring a brighter and healthier future for all. Together, we can make a difference. Together, we can create a world where nutritious, sustainable, and accessible food is a really for all, a world where every child can grow up healthy and strong, where our agriculture practices sustain rather than deplete our planet, and where no one is left behind to our pursuit of delivery well-being. Finally, I would like to express once again to everyone who contributed to develop this report. It is my hope that the workshop report and its result will serve as a catalyst, a pillar, and a cornerstone for the improvement of food system for healthy diets and nutrition in Nepal and other middle income nations. Thank you.
Thank you. Thank you, Dr. Tandon. Now, please join me in welcoming Dr. Mamta Pradhan, Research Coordinator at IFPRI, for vote of thanks. Dr. Pradhan is a Research Coordinator in the Development Strategies and Governance Unit based in India. The floor is yours for 5 minutes, ma'am.
Respected Dr. Jai Bahadur Tandon, our dignitaries on dais, and our very, very dear, very patient participants. First of all, I would like to propose a very hearty vote of thanks to all of you who have been part of this GFPR launch of 2024. As for me, I feel like I'm a very professional vote of thanks giver, having delivered the vote of thanks last year as well, and this year would be no different. I think, but I'm happy that my business card would have an added skill on it. So this launch was expectedly very interesting, very thought-provoking. I want to thank all the dignitaries, Chief Guest, Honorable Minister for Health, Pradeep Podalji, Member Planning Commissions, our Joint Secretaries, Hari Prasad Kesi, our very own Ms. Shabnam Shivakoti, who is here, and who are present for the GFPR launch 2024. I would also like to thank all of our presenters, the speakers, the amazing panelists, the authors of the report who are here. You heard them yesterday. Senior Director Purnima was here, Avinash, Derek, who was online, and many other of the authors who were there to present the results. My special thanks to you, our DG, Charlotte, who is the head of communications. I would like to take a note of and be a very special thanks to our Bangladesh participants. And I would want to mention Dr. Zaidi Katsatar. Please, a big round of applause to them. Dr. Malay, Mr. Shafiq, who is leading the media, and all the media officials who were here, our partners, I think from Nepal, from India, everywhere. A big, big thank you to all of you. I'm sure that all of you, the participants, took note of all the suggestions that were emanating from all the discussions and will be discussing with all your connections and organizations. If you were taking note, thank you so much. In case you were not, still thank you. And I can say that we were just convinced by your presence. I would also like to mention that IFPRI is among the organizations to invest in Nepal for launch of major flagships related events on health and nutrition. We have also worked on insights from flagship work on how to prevent bad outcomes through appropriate nutrition and how to be resilient after shocks. On a very lighter note, we have also been working on novel and adequate foods while appreciating the rich, tasty foods at the launch itself. We were a very informed view to educate on healthier foods, its desirability, availability, accessibility, evidence-based decision-making, which was totally in force. Flavor and taste, of course, rule our choice, even in a conference dedicated to healthy and nutrition rights. My heartiest thanks to all the Marriott officials. I just hope that the bank run on mango salad yesterday was not a case of exception, proves the rule. Truly, George Bernard Shaw said that there is no sincere love than the love for food. Maybe because for me, it's a different. There is no sincere love than the love for sleep. So I bring this because the IFPRI-South Asia regional team has organized this GFPR launch without a break after the IAE conference in New Delhi. Please give them a huge round of applause, and I would request all of them to please come to the front. It's like two South Asian weddings organized in continuity. And those from this part of the world would know what it means to organize conferences of this scale. So the organizing team comprising Joshna, Anisha, Nikita, Manoj, please all come up to the stage. Isha, Rashmi, she's not here. And some of my colleagues who are joining online, Ruchi, Naveen, Amar, Neha, Nitish, who have been sleep deprived at least, possibly food deprived alongside. And all this were led by Dr. Shahidur Rashid. Thank you so much. Please come, please keep coming. My team is there. Come, please, on the stage. I also want to acknowledge their huge, exceptional effort. Thank you so much. And then our very own IIDS team, led by Dr. Vishwas Kochan, is the lead ideal partner and been the greatest support for every GFPR and in everything else. Many thanks for your whole valuable partnership. But I would like to take note of Aruna, Sneha, Nandaji, please come to the front. Devendra, and a huge round of applause for all the young interns. There were 8 of them, exceptional young minds who did the notes so meticulously, which was so useful for our way forward. Thank you so much. All of you, please come to the front, please. So the GFPR actually provides a very perfect opportunity to work together for a food system for healthy and nutritious diets. So let's keep the momentum and take it forward. Let there be no missed opportunity. Let there be no situation as in the Nepali proverb. Since I'm in Nepal, I need to speak in Nepal also. So there is a proverb called Hathi Ayo Pool China, which means the elephant came, but there is no bridge. So that describes the situation where there is an opportunity, but due to the lack of necessary means of preparations, we cannot take advantage of it. So let GFPR launch be an antidote to this conversation, to this saying. IFPRI is never done. We are not finishing with this. So the conversation of IFPRIs will continue, and at a nutrition conference, which is Delivering for Nutrition, which will be organized in Sri Lanka in December. So let me just close by wishing you a happy and a safe journey back. And I don't know if you are trekking. So if you're trekking, those who are trekking, you have all a high spirit and energy in beautiful Nepal. So very namaste and alvida, and then a huge round for us.
It should mean.
Attention everyone, lunch is being served. I would request you all to take your lunch before you leave. Thank you.